Dermatitis is an inflammation of the skin. The term dermatitis is synonymous with eczema. While occupational dermatitis is a skin disorder caused by coming into contact with certain chemical products in the workplace, it is therefore termed contact dermatitis. There are two types of dermatitis, which are contact irritant and also allergic contact. Contact irritant occurs when the skin's outer layer comes in contact with chemical substances like acid, alkalis, body fluid, plants, hair dyes, or nail polish remover. While allergic contact dermatitis is pretty straightforward, your body has an allergic reaction to an allergen. What are the causes of occupational dermatitis? Causes of dermatitis are from allergens such as dust, viruses, pets, and pollutions, while irritants like detergents and solvents also causing occupational dermatitis. Moreover, table here lists a number of well-known chemical product groups and work activities which can cause occupational dermatitis.
Hi guys, Hazmi here. So I will explain to you about the epidemiology of occupational dermatitis.
Occupational dermatitis is number one of all occupational diseases from various of country. There are two types of occupational dermatitis. Number one is irritant contact dermatitis and two allergic contact dermatitis. Irritant contact dermatitis happen when someone in contact with irritant substance such as chemical or particulate matter, whereas allergic contact dermatitis occur when a person have an allergy to an allergen. All age of workers are affected by occupational dermatitis. However, it is frequently identified early in a worker career as a result of exposure to novel irritants and allergens. Next, women are more likely than men to suffer from occupational dermatitis, especially in a field like cosmetology and healthcare. Now, let us look at the economic impact of occupational dermatitis. The first one is the cost of medical treatment and worker compensation. Two is loss of work day and productivity of the workers. And the last is the cost of returning and improving the sector that be affected. These are the jobs with high risk of occupational dermatitis. We have healthcare worker, construction worker, food industry worker, hairdresser worker, and metal worker.
For the second part, I will continue to present about the risk factor of dermatitis.
The risk of occupational dermatitis associated with four factors, which are contact with irritants, environmental, occupational exposure, and skin barrier dysfunction. First, contact with irritants. Certain substances can directly irritate the skin, such as soaps, detergents, solvents, cleaning products, and chemicals in cosmetic or personal care. This is because the substance may include acid or alkaline material in the contents that can lead to risk factor for occupational dermatitis. Second, environmental factors. Extreme temperatures, humidity level, and exposure to harsh weather conditions can increase dermatitis symptoms. Hot temperature can cause sweating and make skin more reactive to allergens and irritants, especially for people with sensitive skin. Third, occupational exposure. Certain occupations that involve frequent contact with allergens, such as healthcare worker, cleaner, hairdresser, or mechanics, are at higher risk of developing occupational dermatitis. The risk occur due to the direct cytotoxic effect of an adverse chemical or physical assault on the various components. This event trigger activation of the innate immune, with resulting in dermatitis disease.
What is the effect of the dermatitis?
The effect of dermatitis can cause a skin inflammation. Skin inflammation can lead to redness, swelling, and itching in the affected areas of the skin. The skin may appear irritated, rough, and scaly. Next, itching. Itching is a common symptom of dermatitis and can range from mild to severe. Constant scratching can further damage the skin, leading to increased inflammation and risk of infection. Next, skin dryness. Dermatitis often result in dry, flaky skin due to impaired skin barrier function. This can worsen itching and make discomfort. Next, pain and discomfort. The affected skin may become painful, tender, or even develop a burning sensation, especially if the skin is cracked or blistered. Lastly, emotional impact. Dermatitis can have a significant psychological impact, causing stress, anxiety, and embarrassment due to visible skin change and persistent symptoms. It may affect self-esteem and quality of life.
Okay, next, what is the burden of occupational dermatitis?
The first one is physical symptoms. Dermatitis often present with symptoms such as redness, itching, swelling, and skin lesion. These symptoms can cause discomfort, pain, and interfere with daily activities, sleep, and quality of life. Second is physiological impact. Dermatitis can have a significant physiological impact, leading to feeling of embarrassment, self-consciousness, depression, and anxiety. Skin condition may affect self-esteem and social interaction, leading to social withdrawal and decreased quality of life. Next is healthcare utilization. Dermatitis often necessitate frequent visits to healthcare providers, including dermatologists, primary care physicians, and allergists. Treatment may involve prescription medication, over-the-counter remedies, and specialized skincare products, contributing to healthcare costs. The last one is impact on daily activities. Severe dermatitis can limit the ability to perform daily activities, including work, school, and leisure activities. Itching and discomfort may distract individuals and impair concentration and productivity.
So what are the health assessments for occupational dermatitis? Assessing the health effect of occupational dermatitis involves understanding the multi-phase interaction between exposure, individual susceptibility, and broader society impact. This introduction set the stage for a detailed exploration of how occupational dermatitis manifests and influences health outcomes in both workplace and community. Example, residents living near industrial area may be exposed to airborne chemical causing allergic contact dermatitis. Assessment, environmental exposure to allergens in the air such as industrial emission can cause skin reaction in sensitive individuals. Monitoring or two assessment use a surface wipe test, air sampling pump which to measure airborne irritants and allergens, survey and questionnaire, skin condition scoring system, digital photography, visual inspection tools such as dermatology.
So, how to prevent dermatitis at workplace and community? The first prevention is based on the engineering control. Always make sure to enclose machinery that generate fumes and chemicals to prevent the exposure to soot particles and toxic chemicals. Installing a proper ventilation system in the workplace also help in removing airborne contaminants that lead to dermatitis. The next prevention is from monitoring and surveillance. Employers shall offer medical surveillance to the workers, regular monitoring for individuals at increased risk of dermatitis, and also provide access to medical care and treatment for individuals with dermatitis symptoms. Third prevention way is training and education. The employer shall establish a comprehensive training program covering dermatitis transmission modes, system, and also preventive measures. Also, include information about the importance of early detection and treatment. The next one is hygiene practices. The practices are washing hands after finish handling chemicals with mild soap and water. Mild soaps are recommended to minimize skin irritation. Next is to regularly moisturize your skin, which help maintain the skin barrier. The last prevention is workplace policy. The employer shall establish workplace policies and procedures outlining protocols for safe handling of chemicals, guidelines for PPE, and procedure for reporting skin-related health concern. With this policy, it will result to raising workers' awareness and knowledge on the dermatitis risk in the workplace.
In conclusion, occupational dermatitis is a serious health concern in a variety of industry, not just in Malaysia, but also around the world, especially in high-risk sectors such as industry, construction, and healthcare. In spite of current laws, a number of issues prevent this illness from being managed effectively, such as a low knowledge, a lack of supervision, training, and improper use of protective equipment, restricted access to specialized healthcare, and many more. Stronger workplace regulation, more access to protective gear, increased employer-employee education and training are all necessary. By giving this precaution top priority, we may lessen the effect of occupational dermatitis and save ourselves from becoming a victim.